Do you think I'll be here if it was not an emergency? I'm sorry, it is me who determines what the emergency is here. Hello and welcome back to my channel. So today we'll be talking about triage. Triage is basically sorting out patients based on who needs more emergent or urgent care. So when you come to the accident and emergency unit of a hospital, what they do there is triaging, or at least that is the ideal thing that should be done. So because I hear a lot of people complain about how I came to the emergency and nobody attended to me, or they left me there for hours before I was attended to. I think one of the anger these days of most Nigerian doctors is the fact that somebody walks into the emergency around maybe 2 a.m. and tells you that they are here for a full body checkup, or somebody walks in and tells you that I have a cough, and you're asking, okay, since when? And they tell you that they've had this cough for like 4 days, 5 days now, and you are wondering, you had this cough, you didn't come to the hospital, you waited until 10 p.m. until 1 a.m. in the night, you came to complain about a cough that has been there for 5 days. Now, not to say that your cough that has been there for 5 days is not important, but you had the whole day or the last 5 days to come and complain at the general outpatient department about your cough, not to the emergency at odd hours. It's called emergency for a reason. And so when you present with those kind of complaints at the emergency, don't be surprised when you are not getting attention as urgent as you think you should. So there's what is done there, which is a triaging system, which deals with the most urgent or the sicker patients, so to say, the one who is needing resuscitation, who is needing emergency care as soon as possible, that if you don't attend to them right now, you will probably just die right there. Then there's you who came with maybe your headache, even fever, and then you even get upset that you are not being attended to. Then you start shouting, you even start fighting with the nurses, you want to start fighting with the doctors there. Trust me, if you can shout, you can fight, then that's not where you are supposed to be. You are strong enough. Because when you see patients that come in serious emergencies, you realize that, in short, if you have 2 people, one is talking and saying, oh, I'm feeling pain, oh, attend to me, and you have the other one who is just looking at you blank, staring into space, or looking at you and is unable to talk, you know that that one who is unable to talk is in a more serious emergency for you to attend to than the one who is talking and shouting. Because sometimes a patient being unable to talk or even express how they are feeling, probably their airway is compromised, so they can't even talk. Some few weeks back, I saw a patient at the emergency over one of my calls, and he could barely talk. He was sweating profusely. He was wheezing. Like, I mean, you just knew that this man is in like a critical condition, that something needs to be done. And then I also had one time where I had a patient that came in. She told me she was in pain, she was having severe chest pain, and then okay, just trying to even ask 1 or 2 questions and before she would talk. So I even made it a point of duty that, you know what, I'm going to ask the questions, just nod if it is a yes, if it is a no, just nod the other way. So I'm just saying this to say that the next time you come to the hospital, especially to the emergency, please don't be offended if you are not attended to immediately. Because some people's complaint is always that I came before this person, I was here before them, and now they are attending to them. See, you can be sitting for the past 3 hours and then they rush in somebody with a femoral fracture. Of course, I'm going to attend to them. because that person is losing a lot of blood and will still lose more blood, and if care is not taken, that person is going to die while you are seated there with your abdominal pain that what an analgesic can take care of. Again, I'm reiterating, I'm not belittling your illness or whatever you are feeling at that point, but the place is called an emergency, an accident and emergency, for a reason, because it attends to accidents and emergencies. So if your case is not an emergency, that is not where to go to. You go to the general outpatient department, and if you must, then it means that you have to wait. You may even have an emergency and another person has, maybe 3 of you have an emergency, and there's only maybe 1 person at that point in time. Now, I mean 1 doctor to attend to those patients, and it happens anyways because we are in Nigeria and we know that we have a shortage of doctors. So sometimes it's just 1 person on ground to attend to those 3. You have to still check amongst the 3 who is at risk of dying in the next few minutes. If I don't attend to them, then you attend to them, you resuscitate, put what needs to be put in place, then you move to the next patient and do what you need to do. In those situations, you are trying to resuscitate, you are trying to attend to the life-threatening events going on. It's not that you are doing some kind of treatment, you are standing there, you are taking history, you are doing whatever. No, you are dealing with the most emergent situation right now, the life-threatening thing that can take this person's life. So please understand with your doctors the next time you come to the emergency and you are shouting, you are wailing, yet nobody is attending to you simply because they are attending to other emergencies, and you think that your own is so severe. Because I've had patients tell me that, do you think I'll be here if it was not an emergency? I'm sorry, it is me who determines what the emergency is here, because we use the triaging system to determine who needs to be seen first. So please don't be angry with your doctors. They are doing their best to ensure that you and whoever is there is taken care of and gets the best possible care.